Has anyone here suffered from recurrent migraines? I'm sure many of us have, including myself. As adults, recognizing the difference between a headache and a migraine is fairly easy. For children, not so much. Migraines are not a diagnosis, especially in children. They're normally a cause for concern. A migraine could be a precursor for a pre-existing condition or disease. About a year ago, my 9-year-old started presenting headaches. Although headaches are normal in children, we quickly knew this was not your average headache. They lasted hours, days, and sometimes weeks. The doctors gave medicines, but they didn't work. After checking for visual disturbances or problems, they found that he had optic nerve swelling behind his eyes. He was eventually diagnosed with craniosynostosis. Craniosynostosis is a condition where the bones of the baby's skull fuse together early. Per MayoClinic.org, normally during infancy, the sutures remain flexible in the skull, giving your baby's brain time to grow. When the skull closes early, it causes a misshapen head, and this can affect the growth of the baby's brain. The condition is normally diagnosed before the age of 1 and is usually treated with a minimally invasive surgery. Surgery that is performed usually reshapes the head and creates room for the baby's brain to grow. Sometimes a helmet is placed on the baby's head to allow the newly formed head to stay in shape. Headaches are often a sign of increased pressure in the head. As with my 9-year-old, his optic nerve swelling was a result of increased intracranial pressure. That condition is known as papilledema, which is a result of the brain pressing against the skull and creating an increased amount of cervical spinal fluid. My son specifically has sagittal craniosynostosis. There are 4 kinds of craniosynostosis. Per Cincinnati Children's Clinic, they named them as sagittal, coronal, lambdoid, and metopic stenosis. My son's condition, unfortunately, was not treated early on, even though he had all of the signs. This is a diagram of the sagittal craniosynostosis, where the sutures close early. My son, as a toddler or infant, had a larger misshapen head, and of course that resulted in a lot of mean kid comments. Craniosynostosis can be caused by an abnormal gene, but most of the time it's a combination of other things, such as the environment the mother is in while she's pregnant and certain medications that she uses during pregnancy. The CDC recently noted that maternal thyroid disease and fertility meds can also cause this disease or condition. Earlier, I stated that my son had increased intracranial pressure. We were initially referred to a surgeon to have a shunt placed in his brain to drain the fluid. This is when the condition was confirmed and he had to have an emergency surgery so the increased pressure would not cause blindness. A CT scan was used to determine the findings. Due to COVID-19, I was the only adult allowed at the 10-hour surgery and the 2-week ICU stay at the hospital. Some children with this condition have developmental delays or intellectual disabilities. Others do not. When it's diagnosed early, there's normally no residual effects. There's normally no delays that are caused by the condition. Craniosynostosis can lead to blindness, seizures, and even death. After my son's surgery, he did fairly well for the first few weeks. Just recently, the migraines have returned. Our next steps are to repeat all of the process over again and finding out what is causing his migraines. In a word, I'd like to say a headache in a child should never be overlooked, especially when it's recurrent. A misshapen head in an infant or a child should be properly measured to rule out cranial synostosis or any other birth defect. This condition can easily be the cause of migraines and can lead to many things, again, such as blindness, seizures, and even death.